So I'm sure everyone has encountered patients that have struggled with what to do next. AristaMD has created care design framework that enables providers to seamlessly move from recognizing patient needs to delivering care. First is identifying the patient based on triggers. Think of this as your early warning system, like a patient trigger like a recent hospitalization, a CKD patient with an eGFR less than 60. This changes patient care from reactive to proactive to promote early intervention. The second component is care pathways. Care pathways implement specialty guidance to help trigger these action plans. This can be a care pathway that a PCP can follow and manage the patient, submitting an e-consult to receive recommendations from a specialist, or a telehealth visit with a specialist. The third component is care transitions, which is designed for care continuity. This entails following up with the patient, ensuring the care plan is working, and navigating the barriers. So care design solves the critical gap between knowing a patient needs help and actually delivering that help. So as patients move through multiple encounters, the primary care visits, the lab work, specialist consultations, but too often these touch points don't communicate effectively, leaving those patients confused and potentially underserved. So what care design does, it ensures that every interaction a patient has builds on the previous one, creating a truly connected patient care experience where nothing falls through the cracks. What does this mean for your team? It's outcome tracking that happens in the background, triggers that tell patients when patients need engagement, coaching, or escalation. They receive specialist expertise available same day, not after a lengthy referral process. So rather than layering on complexity, this streamlines what you are already doing and makes it more impactful. So, you know what, let's be honest. We all know we face different challenges. I'm sure everyone here has experienced this frustration. Your system flags a high-risk patient. Maybe their A1C is elevated or their blood pressure is trending upward. But then what? You know they need an intervention, but there's no clear roadmap for what intervention should look like. The specialists did their job, the PCP got the report, but somehow the patient didn't get the intended care. And without these standardized protocols, you end up with many different approaches as you have clinicians. So here's how the care design can address these challenges. For performance data integration. So instead of staring at different lab results, wondering what should I do next, the system immediately provides you with evidence-based protocols and clear next steps. So there's no more second guessing or waiting for specialist input to confirm the approach. Everyone knows their role, what needs to happen, who's responsible, and when it should be completed. So that eliminates all the confusion and handoffs that often derail patient care. And then specialist guidance implementation. For example, when a nephrologist recommends starting an ACE inhibitor and scheduling quarterly labs, the system will break this down into specific assignable tasks with timelines and accountability measures. There's no more vague recommendations like consider a cardiology follow-up. Instead, you will get scheduled cardiology appointment within 2 weeks or order these pre-visit tests. It really transforms the specialist recommendations from suggestions into accountable care plans. You're able to see which specialist recommendations are working and which ones might need adjustment. As far as post-visit care, we all know what happens after patients' appointments. They walk out the door with really good intentions, but then life just gets in the way. If a CKD patient needs lab work in 3 months, a medication review in 6 weeks, and blood pressure monitoring in 2 weeks, all of these are automatically queued up. This is especially critical for those chronic conditions where consistent monitoring can prevent complications. And then as far as impact, we are tracking those outcomes throughout the entire process, so we ensure that we get those results. So care design within the care ecosystem. At the end of the day, it is how you get the right care to the right patient. There's a 3-phase approach. So the initial plan is the nurse reviews the chart and selects the appropriate care setting that ensures that the evidence-based plan is aligned with the patient needs. It creates that roadmap for ongoing care. And then if an issue arises, the nurse managers can re-engage when we need to modify those care plans. And then as far as integration, this feeds into everything: the pre-appointment guidance, the follow-up priorities, and the outcomes tracking. And here is an example of basically the care design in action, that complete patient journey. So just wanted to walk you through how that works. At first, the PCP identifies the patient to trigger that intervention. Then the nurse manager will review that evidence-based care plan and analyze and look at the different patient circumstances. Then that care design is going to guide that nurse manager to select the appropriate care delivery for the patient. And then the care design guides the specialist to provide specialist care via e-consult. And then using the evidence-based care plan from the specialist, the care design helps the care support team know how to engage with the patient. The PCP implements the treatment plan with the patient, and then that care team follows up with the patient to review care instructions and to provide any coaching that's necessary. And then that care design nurse will monitor that patient's condition and coordinate that ongoing care. And then finally, we track those patient outcomes and make sure those care gaps are closed, and then the overall performance of the program is optimized. And now for chronic kidney disease care pathways, I'll turn it over to Dr. Patel.
Thank you, Brandy, for that really nice introduction in terms of the care design of the care pathways and how it can really impact the care we all provide to our patients. I wanted to take this opportunity to provide a little bit of an example of my specialty in nephrology and how interacting as an e-consult specialist with you all, how it's been able to, how I feel we've been able to advance the care of many of our patients together, and how we can further optimize that. So as an example in regards to the care pathways, as Brandy had nicely demonstrated, in that patient journey, as the nurse manager helps identify kind of the e-consults that are potentially necessary for that individual patient, and the e-consults are then distributed to the specialists such as myself. There's a number of aspects I think that are particularly helpful in optimizing and maximizing the utility of the e-consult for each individual patient's care. So, for e-consults in chronic kidney disease, which I think are many of the e-consults that I have received thus far, oftentimes the question comes based on a review, as noted by Brandy, of the labs. There's a question: is the patient experiencing decreased kidney function? And this can often trigger an e-consult to nephrology for the evaluation and optimization of the management of chronic kidney disease. In the process of receiving a number of these e-consults for chronic kidney disease, there's a few aspects that I found to be particularly helpful, again, to really provide the most helpful and direct suggestions or recommendations to really advance the care of each individual patient. In regards to the assessment, some helpful information to provide in the consult include what stage of kidney disease the patient is in, if there are any specific symptoms or issues the patient's experiencing, and sometimes it's not clearly evident if it is or if it is not related to this chronic kidney disease. But as a specialist, it's helpful to understand some of these symptoms and signs that you are seeing firsthand to see if there is any potential impact, either in terms of better understanding the etiology of the chronic kidney disease or also understanding the potential complications. Certainly understanding the past medical history is important context. In particular, understanding if the patient has diabetes, hypertension, or other comorbidities, and even a little bit in regards to the specifics, particularly understanding how long a patient has been on diabetes is relevant to understanding kind of the likelihood that the diabetes could be playing a role in the chronic kidney disease and what role that may be. So these, I think, nuances are important to kind of remember in the eConsult platform, that at least for these specific past medical history or conditions the patient has, having a little bit more details is particularly helpful. And this is specific, obviously, for chronic kidney disease, but I think similar things can be applied across the eConsult platform, and really trying to think from the perspective of that consultant, what information could be really impactful in terms of understanding the question that's being posed. Additionally, for chronic kidney disease, having a longitudinal assessment of the kidney disease by providing the eGFR and or creatinine over a couple of years certainly is able to better understand kind of what that risk of progression is, and also really pinpoint, whether specific time periods in the patient's history in the past few years where the kidney function has acutely declined, and really trying to understand, has there been any changes during that time that we can pinpoint and then can correct. And oftentimes the most common is medication changes. And so understanding what medications the patient is prescribed, but also not just the prescribed medications, but also if the patient's taking any over-the-counter medications is particularly helpful. And that would include any supplements. And then really trying to pinpoint if there is a sudden change or sudden worsening of kidney function in the past few years, if there is, trying to look back and play detective to see if there are any medications that were changed around that time. Having that kind of information and granularity certainly is helpful in terms of, again, providing the best recommendations to impact your patients. And then having an understanding if there's any family history of kidney disease can be helpful. Now, certainly as part of the eConsult process, there are certain diagnostic tests that I may recommend. But if there is an opportunity to provide some of the basic diagnostic tests as part of the initial eConsult, that can certainly expedite the evaluation and the recommendations that can directly impact the patient. So what I've personally found particularly helpful for these chronic kidney disease eConsults is at least having a basic metabolic panel, which would include serum creatinine and an eGFR based on that serum creatinine, a urinalysis with sediment, which, depending on the results, really kind of changes the scope of how many diagnostic tests would be needed or sent, a urine albumin to creatinine ratio and a urine protein to creatinine ratio, and a complete blood count. And then additional information such as the renal ultrasounds, some form of imaging, a 24-hour urine collection if the patient has received one, iron studies such as iron, transferrin, and ferritin to look at complications of CKD, as well as phosphorus, parathyroid hormone, and 25-OH vitamin D, again, to look at some of the complications of chronic kidney disease. So, every patient is different, and we all know that, managing each individual patient can be particularly challenging, and there's not one size that fits all. But I hope that at least some of these kind of tidbits and rationales, for why some of this information is particularly impactful for me as the e-consultant to really try to provide the most direct and and impactful recommendations hopefully is coming through and clear. So I think Brandy did a very nice job in touching upon this earlier. Really the goal of the care design program is really to transform the idea of moving away from reactive care to proactive care. And so really, prior to care design, really our patterns are to reactively respond to a patient's condition. So when they have experienced some form of complication from their chronic kidney disease, or they've gotten to a state where their hyperkalemia is not able to be controlled, and really looking to intervene on a patient's condition rather late in the stage of disease. So really these, I think, offer missed opportunities to really change the trajectory of the patient's care and the course of their disease. And ultimately, fragmented communication prior to care design between all different types of providers as well as the patients really, I think, contributed to part of this reactive pattern. So after implementation of care design, really the team coordination, I think, is of utmost priority and will be a clear impact in terms of delivering optimized care for our patients. So being able to clearly identify roles and responsibilities to provide a unified care approach, and then ultimately, as Brandy had nicely shown, really then feeding all of that back to the patient to ensure that there's an improved patient understanding. So we, again, don't miss that opportunity of ensuring that the patient is able to understand and act upon the recommendations and suggestions that are delivered as part of their care. So for now, there's some practical examples that we're looking to really institute here. So this new CKD patient pathway, which will help identify CKD patients early and prompt appropriate consultation to provide meaningful changes to advance their care and minimize disease. I like to take a second just here. Nephrology has been challenged for many years without many available therapies to change the course of our disease. And oftentimes nephrologists were sitting on the sidelines waiting for the progression of chronic kidney disease and managing complications. But in the past 5 to 10 years, we've had an explosion, I would say, of new therapies that are available for patients that can actually change the course of disease, delay progression to end-stage kidney disease, and have meaningful impact on patients' lives. And so really this new CKD patient pathway is an opportunity for us to really identify those patients early, to institute these therapies that can really have long-term benefits in terms of delaying progression. And the earlier we intervene, the greater the benefit that is seen. So really excited to see this pathway put forth and what the benefits come out from this. Certainly, I think we all see the eGFR of our patients, and it can go up and down and up and down, and really understanding what constitutes a meaningful decline, and in the context of the different medications, symptom signs, comorbidities that each individual patient has. We can help define a protocol to address and monitor. One, to monitor the decline, and then also to treat and appropriately adjust medications as well as treatment paradigms to help, again, minimize that decline. Another key example is blood pressure management as well. And this is hypertension being one of the most common comorbidities that our patients face. particularly in patients that have difficult to control blood pressure, having a protocol to be able to lean on to really help standardize when appropriate the management, but then additionally, being able to know how to modify that algorithm for each individual patient based on their specific needs, comorbidities, and individual profile. So ultimately, we hope to have patient outcomes ultimately affected by this this pathway and this design, and really show how we're able to slow progression, manage very complex cases, and ultimately, for CKD patients, prevent dialysis and transplant needs. So I believe I will take this opportunity to hand this back to Tiffany to take us through the implementation framework.
Yes, actually, Brandy, I'll let you take the stage. We just weren't able to hear you before.
Sorry, yeah, I've noticed I was on mute. I apologize.
Thank you so much. And
Apology.
thank you as well, Dr. Patel.
Yes, thank you both. So we'll talk about the implementation framework. It's a two-phase approach. The initial care design is where everything begins. It's our systematic approach to identifying those patients who need intervention and connecting them to the right care pathway. The system monitors your patient population using those key clinical indicators. So your eGFR levels, the A1C trends, any type of blood pressure patterns. When a patient is flagged, your nurse doesn't just see an alert, they get a complete clinical picture. When specialist expertise is needed, it's built into the process, so there's not additional referral workflows or delays. So, and then it goes into the adaptive care design. So the initial care plans are just the beginning. We need to remember real patients, they have real lives, and sometimes things don't go according to plan. And the system will monitor that patient's progress and actually will flag when things aren't going as expected. For instance, maybe the patient isn't taking their medications, their lab values are worsening, or they've developed new symptoms. So when those issues are identified, it recommends specific protocol adjustments. If medication adherence is the problem, it might suggest switching to a different medication or adding adherence support. And then the system will also schedule those appropriate interventions based on that updated protocol. And then throughout all of those different adjustments, the system is maintaining the record of what's being tried, what's working, what's not working. So it really, that care becomes truly personalized and responsive. And our assessment. So our key takeaways, just so addressing those care challenges, we need to remember that frustrating gap that we talked about earlier, knowing a patient needs help but not knowing what to do next. This care design helps eliminate that gap. When you identify a CKD patient with an eGFR below 60, you have access to care pathways to provide next steps. No more wondering what we should do. The answer is right there and it's ready to be implemented. Your team can move from a reactive problem solving to proactive, protocol-driven care delivery. And then as far as the response time in traditional healthcare, getting specialist input can take weeks to months. So we've had the ability to have that turnaround time in 24 hours. Through those integrated e-consults and the care pathways, the patients get specialist expertise when they need it, not when the schedule allows it. And that means early interventions that can prevent hospitalizations, help slow that disease progression, and improve their quality of life. And then as far as the follow through, this is where a lot of that care coordination fails. But the built-in triggers ensure that every patient can stay connected. And when a patient's condition changes, that system will automatically escalate their care and adjust those follow-up schedules. So this way, no patient falls through the cracks because they're constantly being monitored. So bottom line, this care design has the ability to transform your care delivery from being reactive and fragmented to being proactive and coordinated. You're not just managing patients, but you're actively improving their health trajectories through systematic evidence-based care.